Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have post ischemic. There is post ischemic dysfunction, also called as stunned myocardium. Here, this stunned myocardium, these are actually here you have given you have given perfusion. Okay, even after reperfusion, if this contractile dysfunction persists in myocardium even after reperfusion, after transient ischemia, is called as stunned myocardium or post ischemic myocardium. But here in this stunned myocardium or post ischemic myocardium, there is no irreversible damage. Irreversible damage is not there, and there is no irreversible damage, and there is normal or near normal perfusion is present. So in these patients you will see that there is normal perfusion or near normal perfusion is seen, but the main problem is in post ischemic dysfunction. Even after you reperfuse the myocardium, it is not getting back to its original contractile activity. So that is stunned myocardium.
thank you and thank you for watching.